quantum physics is not an invention, it's a discovery. So when you actually break down matter and you come to the atomic part, you realize that the atoms are really empty. We're trying to find answers in Newtonian physics, but the answers exist in the realm of quantum physics. So in Ayurveda, we classify herbs in two things. We call it Swasthahitakar, which means that if you take these herbs, they are very close to human frequencies. And then there are treatment herbs where you can't overuse them. In Ayurveda, there is an entire concept called Rasayan. Rasadhatu is the first dhatu or tissue that is formed from whatever you eat, your food. There are two kinds of people in this world. There are seekers and there are believers.
Hi everyone, I'm Mandira Bedi, your host for the Nutrify Today Boardroom Series Lite, brought to you by Green Space Herbs, where the nutraceutical industry's sharpest minds meet the most unexpected questions. Today's guest is a celebrity Ayurveda doctor who's taken the leap from ancient scrolls to scientific journals, pioneering the fascinating world of quantum Ayurveda. He's published research, stirred curiosity, and yes, made even molecules sound glamorous. Please welcome Dr. Manaan Gandhi.
Thank you.
How much do you practice Ayurveda on yourself?
I always feel when what you think, what you say, and what you do, if it is aligned, you are not fractured. And if you are not fractured, you have a moral authority. Whenever you say something, the power that comes behind those words is always much higher compared to when you're saying something while you're doing something completely
It comes
different.
from a place of knowing, it comes from a place of knowledge, it comes from a place of experience. Okay, so, first up, I'm going to give you my pulse.
Okay.
And I'm going to say, tell me about my doshas. You don't have to tell everybody what my my health issues may be, but you can maybe tell me what my dosha is.
I mean, yeah, that's pretty simple. So show me your right hand actually.
Yes.
So currently your Vata is a little high. However, your Pitta is also a little high. I think let's just keep it at that. There are a lot of minor health issues, but we'll probably discuss them off camera. Nothing major though, nothing to worry about.
Okay. It's good to know. Dr. Ayurveda is thousands of years old, and quantum physics is, talked about, and it's barely a century. How did these two end up in one conversation? Quantum Ayurveda. How did they end up as a term?
So Ayurveda is definitely 1,000 years old, and quantum physics is not an invention. It's a discovery.
Yes.
The difference between an invention and a discovery is an invention starts from the time it is being invented, whereas a discovery is just trying to unveil secrets of the universe.
It's been around from the beginning of time.
Absolutely. So,
Just studied recently.
Precisely. The quantum realm is being studied recently. However, I also do not agree with that fact. When we look at the ancient texts, I think it's very unfortunate that over the years, most of our texts are not well documented, and when they are, they're not read by the common public. So there are a lot of misconceptions because at best people would read translations of other commentators rather than the actual text itself, citing maybe language difficulties or availability issues or merely interest. Even not just in Ayurveda. In Ayurveda, there's plenty of quantum physics, but even apart from that, we have an entire Darshan Shastra. So where we have Sankhya Darshan, which talks a lot about how consciousness creates the universe. And then we have Vaisheshik Darshan, who goes into the nitty-gritty and tells us about how subatomic particles coalesce and come together to form atoms and then to form the entire universe. So all of these science are very well documented. They're very well written. It's just unfortunate that the common people don't know about it.
And how do we get the common people to know about it? Through quantum Ayurveda?
I guess you don't need to know what the rishis said. You need to know what the universe is. The entire pursuit of science is to try to uncover the universe to no specific end. So there is no vested interest in discovering the universe. It is merely to answer 4 basic questions. These 4 basic questions are not asked by an individual. It's asked by every single one.
Okay, the 4
Who
questions.
am I?
Who am I?
What is existence? What is my role in this existence? And how can I play it best? These are the fundamental questions that even a child would ask.
But these are questions very often we can spend an entire lifetime finding the answers of.
No, we spend multiple lifetimes finding the answer.
Okay,
This is spirituality.
Yes, that's right. That's right.
Yeah.
So, there are some people who are evolved and can find some answers at the end of one of their lifetimes.
The problem is not, are you able to find the answer? Every single human being is capable of finding the answer. Similar to every single female, a healthy female, is capable of reproducing. So we all have that potential, right? The problem is, do we have the depth? And what do I mean by depth? Is when you take a subject and you go as deep as you can, you don't just touch it superficially and move on. When you have depth, you have all the answers.
You're a very deep person. After listening to what you're saying already, I don't know what my next question is, but I will get to it. Why do we need to understand Ayurveda, health, or any biological parameter through quantum physics?
Because there's a vacuum, there's a lacuna. So the way I can explain this is that for any event to take place, there is a principle, there is a process, and there is a result. A lot of times what we've seen is that we've applied, let's say, a very basic principle of Ayurveda, and we've gotten the result. But when inquired or when asked, most, if not all, Ayurveda doctors have absolutely no clue what the process was. And this is where Ayurveda really loses out, because no one can really explain the process of how this principle is showing this result. Whereas the result is evident, but there is no scientific way where we can prove
there's a principle
this.
And that gives a result, but there's no attention to the process.
No, there is attention, but there are no answers. I mean, even if the answers are there, if you actually listen to them, they're very vague. Because we're trying to find answers in Newtonian physics. But the answers exist in the realm of quantum physics. Now, quantum physics is again very deep, very vast. But I can cite examples for you if you'd like. Right? For example, a professor of mine was doing a research on Nasya. And Nasya basically means nasal installations. So he's putting drops in the nose and trying to achieve an XYZ result. He'd already seen results multiple times. He'd treated multiple patients. He knew that. But what he was trying to do, and I think this was his PhD thesis, if I'm not mistaken, I might be wrong there. But he was trying to use an isotope. An isotope that is radioactive, which means that you can actually see where the drug is being absorbed in the body. And where it's being absorbed, how much of it is being absorbed, and how it is showing an effect. You know what he found out? It's not being absorbed. But it's showing effect. So how?
So that's the process.
That's what I say, that when you're trying to identify and decipher Ayurveda in Newtonian physics, it probably
might not
fails.
Get the answers.
It probably fails almost every single time, which makes it a pseudoscience in these scientific minds, right? Because they're deciphering it in the wrong way. I will probably touch upon, I don't want to answer everything before you even ask me a question, but there is an entire concept of entrainment, which I will explain, right? Maybe in the future.
No, but I'm not, we'll get to entrainment. What I need to know right now, simplify it to me. Teach it to me like I'm a 10-year-old.
I'll make it very simple for you.
Yes.
Every single element, every single matter, every single thing in this universe tends to move towards zero potential. So if I have a charged positive atom, and if I have a charged negative atom, they want to become neutral. They want to become inert.
Okay.
Every single thing wants to become inert. If I pour water from a high potential, it will fall down towards the lower potential. So everything tries to go towards zero potential.
Zero potential or a neutral state.
An inert state where they're at peace, where there is no charge, where there is nothing. So even human souls try to go away from positivity and negativity, try to go away from karmas where they are absolutely at shunya, at peace,
and
at zero potential.
Where are they at that? Where are they at peace and shunya and zero potential when they're in the other realm?
I think.
My gosh, this is getting deep.
So, I'll try to make it a little simple. I know I'm probably complicating it. So, what we're trying to do here, you have to understand, is that every human is trying to go towards peace.
Yes.
In whatever.
That is a natural state.
That is a natural state, but that's not just of a human, that's of every matter. That's why reactions take place. So, there is a Na plus and a Cl minus. They'll become salt, right? NaCl, because it's neutral. So that's how, if you look at any single thing, any single being, any single particle in nature is trying to move towards zero potential. And that's where entrainment comes in. Entrainment is basically you reacting to the environment and trying to come to zero potential in relation to it. So for example, right, imagine I have a grandfather clock moving here.
Yes.
Right? And there are multiple grandfather clocks. You know what will happen? Initially, they're all moving in their own speed and their own this thing.
They all equal out.
They'll equal out. Why do they equal out? That is entrainment.
Now tell me about ancient herbs, because I would like to know a little bit more about their frequencies and how you make those frequencies work for the frequencies of our bodies.
Maybe before we touch on to the ancient herbs, let's just talk about what frequencies are and what is this entire,
Vibrations.
shebang. Yeah.
Yes.
What am I talking about?
Yes.
So let me break it down in a very simple way.
Yes.
Right? The entire universe, when you actually look at everything, this seems to be like a solid chair. 99.99% it's empty. Why is because made of? There are atoms, and then atoms are 99.99% empty. There's one small nucleus, and far off there's one, minuscule electron just roaming around. And what's in between them?
Space.
Yeah, so this entire thing is 99.9% empty. But does it feel that way?
No.
It doesn't. So when you actually break down matter and you come to the atomic part, you realize that the atoms are really empty. When you break down the atoms further, then you can go on to mesons, bosons. We're not getting into the technical know-how here. But the point is you start realizing that all of them are nothing but frequencies. They're not really matter. They're frequencies. Right?
They're vibrations.
The vibrations, essentially. And vibrations vibrating at a certain speed is what we're calling as frequency. Let's say that your natural frequency, this is really stupid for me to say this, but let's say your natural frequency is 100. Okay. And for whatever reason, your frequency has now become 105. How do you
know your... Okay, let's... Please.
The diagnosis.
I'm simplifying it even further. How do I know my natural frequency is 100?
There are a lot of diagnostic tools, right, that can probably check that. I think the best one that I practice is Nadi Parikshan. Nadi Parikshan is...
Where you told me I've got health issues, okay?
Yeah, let's get to that a little later. But
So say my natural frequency is 100, but it's gone up to 105.
Right.
And your whatever tool you have to diagnose it has told you that. Then?
So now, how do I get it back to your normal self or 100? Now, there are two things I can do. I can impart something that's a little low frequency.
Yes.
If I impart something low frequency, through entrainment, your frequency becomes normal.
Yes.
Very simple.
Entrainment, yes.
Entrainment, because you try to go to zero potential. So anything that is exposed to you, passively and actively, your body tries to merge with it. Actively through digestive enzymes and passively just by mere contact. Right? And which is where Basmas come in Ayurveda, which is nanoparticles. I'll come to that a little later. Right? So, what we're trying to do is we've tried to identify herbs in Ayurveda and what kind of a role they play. Now, these frequencies, as I said, we have 5 sense organs.
Yeah.
And these frequencies also work in 5 different ways.
Yes.
Right. So, we've actually broken it down into 5 different ways.
Okay.
Not getting into that detail, but it's there in Ayurveda. Everything is clearly mentioned. And the funny thing is easily available as well. People don't look for it.
Where do you look for it?
So many places. There are books all around. I think you can now. AI has information that they can concise and give it to you.
Okay.
Right?
ChatGPT and I are going to have a conversation on the way home today.
Yeah, but I don't know how accurate AI is because AI tracks things online and Ayurveda's online is a whole mess.
Okay.
Having said that, there are 2 ways I can give you a lower frequency thing, or I can constantly supply with 100 frequency to you. That's the easiest thing. And then slowly and steadily 105 or 95 will just come back to where it is.
Yeah.
So in Ayurveda, we classify herbs in 2 things. We call it Swasthahitakar, which means that if you take these herbs, they are very close to human frequencies. So they will constantly keep correcting the human frequencies.
Okay.
And we give curative medicines. So the Swasthahitakar can be used indiscriminately by anyone for a long time.
Okay.
And then there are treatment herbs where you can't overuse them because then you'll go down, right?
Those are vastly different frequencies from
Correct,
from
but then we're giving it the opposite. So then,
yes.
Yeah. So that's called Samanya Vishesh Siddhant, where you either give the Samanya, which means a similar kind of a frequency to increase it, or an opposite kind to decrease it. So that is one of the things.
So are there, like, for example, we live stressful lives over here in Mumbai. Are there any, are there any herbs that can bring now, when you're stressed, is your frequency higher? Is that what happens? Your frequency goes down.
Yeah, precisely.
It dips.
So frequency itself doesn't work on just one X and Y this thing.
Okay.
So there are multiple variants to it. But I think...
Okay, say your frequency changes.
Fair enough.
Right? So you give something, so it's a quantum Ayurvedic doctor who can find the right frequency, or is it an Ayurvedic doctor who can find the right frequency?
Ayurveda works with quantum physics as its core principle.
Already.
Right?
Yes.
Now, whether the doctor understands the process or no, it still works.
Okay.
So if you don't know how the pen works, you can still scribble and it'll still write.
Right.
You don't need to understand the process
Got it.
in order to achieve the result.
Fair.
However, knowing the process is important because that not only opens your understanding but allows you to fiddle, fidget, enhance and improve a particular system. Because without knowing the process, you have no way of doing that.
Let's go a little deeper into entrainment. So you're saying that if something has a certain vibration and something close to it has another vibration,
Right.
the natural tendency is for the two things to merge so that they reach a state of inertia.
100%. So what we're doing in Ayurveda or in almost all of the alternative healing modalities is we are trying to give corrective frequencies to the body via different means. Now I could give it to you. I'll explain. I can give it to you via herbs. So herbal medicines, right? They'll work, no problem. But if I give it to you via Basmas, you know what Basmas are? Basmas are nanoparticles. So when you take something and you make it a Basma, why are nanoparticles so important? Is the same answer of why your intestine so long. I mean, this intestine from here, I mean, we're in Andheri, so it'll probably go to Bandra. That's how long it is, but it's this much.
Yeah.
Why? Is because surface area is important for absorption, but surface area is also important for imparting frequencies. Because the bigger the surface area, the more more you're in touch, right? So the more frequency is imparted. So whenever you're giving nanoparticles, the nanoparticles of Basmas are actually not even meant to be absorbed in the body.
How do you give them?
I mean, you make Basmas and you can give them in terms of medicines.
So it's like medicines.
Yeah. So you have in Ayurveda, we do use a lot of Basmas, right? But if it is properly made, the Basmas are not supposed to be absorbed by the body. They are in fact removed from the body, but they impart the corrective frequency and go.
So they impart the frequency and leave your body.
Precisely. Because they're metals and metals always impart frequency much better.
So Bhasmas are always metals?
Not always metals, but a lot of times we do use metals.
And it's something you ingest?
You ingest, but it's not absorbed in the body. It just comes out of the body after imparting the correct frequency.
And what if it gets caught somewhere in those many
miles?
That
means it's not well made. And if it is not well made, it can actually get sedimented. It could be very dangerous. And that's why Ayurveda
you're scaring me. I thought quantum Ayurveda was just like super safe. And if you're trying to say if its practitioner doesn't understand it too well or it's been badly made, it can get
I mean,
stuck
even if the practitioner doesn't understand it, will work. It's just that it has to be made in a very quality controlled kind of a way. Okay. So you can
one way is to give herbs, the other way is to give nanoparticles.
Now you can impart frequency through your speech. So mantras work like that. How else do mantras work? A lot of times I've seen these scientific people, they come and talk about science and they say how scientific minded they are and this and that. And the minute a miracle happens, the science goes away. Because rather than framing their entire worldview to match the universe, they try to match the universe to their worldview. And if the universe doesn't comply, then it's a miracle and it's sidelined. It becomes statistically insignificant. Whereas it happened literally in front of you.
So what kind of mantras are you saying?
I mean, I'm not going to give you like a mantra, but I'm just saying that every sound wave or every phonation has an impact on your body. Why does
mantras have a frequency?
Precisely.
Yes.
So, there are three kinds of
mantras.
They
can also be administered like, I won't use the word medicine, but as a...
No, why not use the word medicine? Of course, they can be administered.
Okay, mantras can also... So, it's like 1 second. Bhasmas, mantras... And
I've given a couple of things I can go on and on.
No, I'm trying to remember it. I'm trying to understand it.
Even yantras, even light can be worked in that way. You have people who give light different color therapy. You have people who give various sound healing. How does that work? People know it works, but people don't know how it works. And most of the people who practice all of this maybe aren't really good at it. So they don't show like the results. So a lot of people are a little dismayed by a lot of things. And a lot of things is mumbo jumbo as well. So, I'm not going to tell you that everything is great, but I'm trying to explain that there is a science and there is a process which cannot be explained in Newtonian physics, which is why it's not so evident.
Now, the way you're explaining things was not the conversation I thought I was going to have. I must tell you, and I say it in a very good way.
Okay.
How do you convince the skeptics who think that Ayurveda is just, grandma's recipes in,
to try and understand that
fancy packaging?
Okay, fair enough. I mean, to answer that question, let's start understanding what are skeptics. There are two kinds of people in this world. There are seekers and there are believers. A person who needs to believe means that he doesn't know. The minute you believe something means you don't know it. You're merely believing it.
But you can believe things to be true because you've experienced it. I believe it because it's happened to me. I believe it.
So then you know it, right?
Okay.
But you don't know the process then. It's happened to you, but you don't know how it happened. Right? That's why you're believing it. So the minute belief comes in, it means, or faith comes in, that means that you don't know. In Ayurveda, we encourage every single person to be a seeker and not a believer. Because the minute you believe, you stop thinking about it. So let's say a child comes and asks you, what is going to happen after I die? And every child asks this question without exception. Right? If there's an exception, I have no knowledge. But so you say, no, you go to Swarg and you go to Nark. The minute you give an answer and you try to shut the child up, you are removing the seeker from him. You're asking him to or her to believe in something. Most religions try and do that. They make believers out of you. There is probably only one religion that advises you to ask more questions and seek, whereas most of them deter you from asking more questions and from seeking.
No, but I believe in God, or I believe in a universe, and I believe in a power. Yes, I don't know how it works. So that part I agree with you. I don't know.
Right.
But I believe, and I
Yeah.
believe it to be true, and I believe it to be real.
Right. So people who are skeptics, they have no understanding of how this works. They believe it doesn't work.
Okay.
So the people who believe it works and the people who believe it doesn't work are both wrong, because none of them have taken the effort to know. So anyone who yeah, I mean, it's so easy to become either a believer or a skeptic, and both are equally wrong. You need to actually try and understand something before you form opinions. And in these days, people don't go deep enough in anything. Even their own subjects, they have no clue what they're talking about. Most people just blabber on and on and on without really knowing anything in depth. And maybe they're doing it for economic purposes, or for commercial purposes, or for whatever purposes, I don't know. They have their own purposes, they have their own palaces that they've built in order to achieve the simple happiness that they could have achieved without doing anything. But having said that, this entire concept of belief is very antithetical to a human's basic nature. A human's basic nature is of a seeker who tries to learn, who strives for knowledge. This is the basic fundamental of a human being. Why do they have knowledge? Is because knowledge is the only thing that can liberate you and get you to zero potential, which is exactly what we started off with.
In quantum Ayurveda, which herb or therapy is, in your research, is one that's really effective for, say, aging, which is like the fountain of youth?
So in Ayurveda, this is very interesting actually. In Ayurveda, there is an entire concept called Rasayan. And I'll explain this a little bit. Every single human being, not just human being, but every animal or everything, as the days progress, they are progressively aging. So aging is like a progressive disease.
Yes.
Right? Let's say I have like a newborn baby, a 1-year-old. I can put both the legs behind their head and they'll still be laughing.
Yes.
Because they're flexible. The body doesn't even have bones. It's just majorly cartilage. Right? So even if they have fractures, they don't actually have fractures. The bone just twists, which you can correct. So their entire body is not hard. It's very fluid.
Yes.
It's very lubricated in a way. You understand what I'm saying?
Yes.
And as you age, you start realizing that the body starts losing a lot of its lubrication and starts drying up.
Yes.
So a 6-year-old now, you try to put both the legs behind their heads. It's very difficult. If they're actively practicing some yoga or gymnastics or something, maybe.
Yes.
But that's not a common thing that you'll see. As you age, the muscle fibers also become a little harder and they start losing lubrication. And this is Ayurveda called as Rasadhatu. Rasadhatu is the first dhatu or tissue. We could probably call it plasma in a very non-technical sense. That is formed from whatever you eat, your food. Rasadhatu is responsible for creating more and more tissues. So aging is merely just more degeneration than regeneration. It's very simple. For an old age person who's aging, the rate of degeneration is higher than the rate of regeneration, which is why they start losing mass. You'll start seeing old age people start shrinking.
Yes.
And all fluids start shrinking.
Yes.
So whether it's the synovial fluid in their knee,
yes,
that shrinks and then they have age-related arthritis, or whether it is just the nerves that have started shrinking. So people have, the brain starts shrinking when you age, if you look at a scan.
Yes.
Right. So there is cerebral atrophy.
Yes.
Or they have, between the nerves, there's a fluid that helps in conduction that starts shrinking, that causes Parkinsonism. And there's Alzheimer's and there's dementia, and any of these geriatric problems. All of these problems or all of aging in general happens because the body starts losing
Fluid.
rasadhatu or fluids.
Yes.
So we have a concept in Ayurveda called Rasayan. Rasayan is anything that increases this rasadhatu.
How do you do that?
Yeah. So there are two things that you
Is that
can
what
do.
you're taking?
Yes, I have. But, there are two things there. So there are two kinds of Rasayan. One is called Vatatapik Rasayan and one is called Kuti Praveshik. Kuti Praveshik means that you move into an area which is devoid of sunlight and any sort of wind movement.
Okay.
So you see all of these sages start moving into gufas,
Yes.
which is devoid of sunlight and devoid of any wind movement.
Okay.
It's basically like human hibernation.
Okay.
So that is Kuti
you don't-
Praveshik.
So you don't live in a cave. That's
I mean-
that's
But the
know
second
that.
type
yes.
is Vatatapik. Vata means air and Atapa means sun.
Hmm.
So where you're living in sunlight and air, which is you're living in society, you're living, doing everything, you can also do Rasayan there. And you can use herbs that are Rasayan herbs. These Rasayan herbs are like, there is something called as Brahma Rasayan, which is the first Rasayan mentioned by Charak, Acharya Charak,
yes.
who's written like
yes.
the foremost treatise of Ayurveda. It's also available in the market. A lot of people make Brahma Rasayan. There's Chavanprash Avliha. That is also Rasayan.
Yes.
Right? So Chavanprash is something that people
Yes.
using, and it's a little funny because my dadi used to do this, and most mothers, they make Chavanprash at home and they give it to their kids. That's not really Chavanprash. That's Avle ka murabba. Like Chavanprash takes a lot of effort. I need like an entire team to make the Chavanprash that we make, and it takes a lot of effort to get huge 10 plants, the roots, and then boil the roots, and it's not something you can literally do at home.
Correct.
But people do take these Amle ka murabbas as Chavanprash with loaded sugars. And now you have chocolate flavored and strawberry flavored Chavanprash.
Which
So
is
it's
not really-
ridiculous.
which is not Chavanprash.
I mean, it's labeled as marketed as Chavanprash, and gullible people fall for it. Having said that, Chavanprash is one of the prime examples.
Of
So there's an entire slew of Ayurvedic herbs that works like this.
Okay.
So these are things that keep your frequency exactly where they're supposed to be. So their
And
frequency
keep
is
the
very
moisture,
close to.
and keep the moisture in your body.
Correct. They
the
keep the
lubrication in
moisture.
your body up.
So I'm explaining this through the traditional understanding, through the dhatus or tissues understanding, and then through the entrainment understanding. So you get a better idea of how these herbs work, right?
Mhm.
They obviously work in the same way,
Yes.
but when you understand them in different ways, whatever resonates with you, probably you'll get that.
What is your Rasayan?
I mean, as I said, we make really good quality Chavanprash and I just consume what I make. In fact, I give my son that as well. He loves his roti with Chavanprash and he just
Without the sugar.
eats that.
Mm.
No, there is a little bit of sugar. I think sugar is demonized for no reason. Sugar is important for the body, but not the processed one that you get from these sugar factories.
Yes.
The natural occurring mishri is important for the body.
Okay.
It's just that people overuse it.
Mm.
Because now we're in a day and age where there are problems of plenty. Earlier, I mean, how much sweets would you have? Once in an occasion. Now we have sweets available on Swiggy in 10 minutes.
That's right.
So yeah, that's an issue.
It's an age of instant, like you just talked about Swiggy. It's an age of instant everything. Instant noodles, instant sugar, instant mithai, instant everything, instant likes. How do you sell a system of health that thrives on patience?
I'm not a salesman. I don't know how to sell it. But I can tell you one thing for sure. Is that no matter how much we have evolved in terms of technology and science, as biological beings, we have evolved absolutely zero. So the body has always remained the same. The human body is not evolved. A lot of technology is changed. The human body still takes about 9 months for a child to come. 5,000 years ago, it took the same time. Today, it's taking the same time. And I don't know, about 5,000 years later, it will still take the same time. Today, a bone's fractured will still take 6 weeks to heal.
That's
A wound still takes the same amount of time. So there is actually no technology or no change in the human body. But what has changed is our expectation of the human body. Because everything around us is moving so quickly, is we expect the human body to move quickly. What is in allopathy, when people really run, when they have a slightest of a problem, it's just giving you symptomatic relief through chemical messengers.
Yes.
Until nature comes in and heals. So the healing still takes the same amount of time.
Yes. There's something that blocks the pain for the moment.
Precisely. So for example, if I have cut my finger a little and it's going to take 3 days to heal, if I go to Ayurveda, I can probably accelerate the healing from 3 days to, let's say, about 2 days. Right? But if I take allopathy, I am relieved in 20 minutes. And
Relief, but the healing is not happening.
Healing only happens by nature. Which pathy can heal? Nothing. Right? So what you're doing here is that you're just suppressing the symptoms and waiting for nature to heal. But there's a problem here. The problem, and I'm not even talking about the side effects, not even going into all of that. But the problem here is that when I'm taking this kind of a relief, every disease doesn't have a cure in nature. So, for example, let's say if I have a cut, if I just wait long enough, it'll go away. Or if I have a fever, if I just wait long enough, it'll go away. Or let's say I have like a mild infection, it just goes away if I wait long enough. But if I have diabetes, how long should I wait for it to go away? Or if I have a thyroid problem, so then you take medicines for life. Because the minute you wake up, you suppress it.
Yes.
No one's actually looking to cure anything. It's all suppressing until nature heals and then credit is stolen as if we healed it.
So does Ayurveda have cures for thyroid and diabetes, like getting to the root cause and
Absolutely.
curing it, like turning it around?
Absolutely. Ayurveda has a cure for a lot of incurable diseases. Again, diabetes is a very vast term. So we have to look at diabetes. I mean, it could be because of medicines, diet, exercise, or stress. Right? It's also there's a big lifestyle element there. When it comes to thyroid, we've cured people of thyroid. They have not required to take medicines and they are absolutely fine. So is it possible? Yes. Is it possible in your case? I mean, not you per se, but in your case, it really depends. Right? I mean, thyroid is not just like there's so many factors there.
Yes.
Whether is it an autoimmune problem? Do you have any growth there? Is it a cancerous? Is it,
Yes.
The disease itself, the multiple things that we have to look at.
Now, when we talk about holistic healing, how does Ayurveda and quantum physics help us understand or treat the patient?
So I think I've already answered the question to a
In
great
some
extent.
part, yes.
Where how Ayurveda helps to understand. But when it comes to treating patients, no, we use whatever is at our disposal.
Okay.
At our disposal, we have a huge treatise on herbs.
Yes.
Right? So we use these herbs. Does that mean that this cannot be treated by any other modality? No, it doesn't. Because you are imparting frequencies.
Herbs, there's
Basmas, there's yantras, there's tantra, there is mantra, there is there are different lights, there's sound, there's so much that you can do, right, to make the patient better. Having said that, in Ayurveda, what we have is we have herbs. Now, what is the beauty of Ayurveda? Let me tell you, there are two huge beauties that Ayurveda has that others don't. In fact, three, but let's start.
Go with three. Let's hear the three.
A lot of alternative medicinal practices call themselves holistic. I absolutely refute this today. Why? Is because if someone... Now, why is a disease that... Any disease that happens, we'll remove the karma and the spiritual part because we've delved in that for quite too long. But the manifestation of a disease happens due to 4 factors. Ahar, which is food. Vihar, which is your surroundings. Achar, which is your regimen or a lack of regimen. And vichar, which is your thoughts. So ahar, vihar, achar, vichar are the 4 factors that can lead to a disease. And now that you'd mentioned diabetes, we'll probably take that as an example. Right? Ahar. So diet can definitely impact diabetes.
Yes.
Vihar, which means your surroundings can have an impact. Achar, which means your regimen or a lack of regimen. You're just sitting the whole day or sleeping the whole day.
Yes.
Right? And vichar, which is thought. So you have stress-related diabetes. So let's say a nutritionist, a dietitian or someone comes in and tells you, listen, I cure diabetes and I have X, Y, Z success in this and that. And let's say if it's stress-related, how is a dietitian going to cure that? Or let's say the person doesn't exercise. What role does a diet have in that case? Is that holistic? No.
Correct.
Okay, then let's look at Vihar. So let's say a person who does, I don't know what, color therapy. They surround themselves with color or sound. So they're changing the surrounding environment. Right? Is that holistic? I'm not saying whether it's effective. My question is very different. Is that holistic? It's not holistic. It's not looking at all the factors.
Yes.
A holistic, by definition, is that you're looking at the whole. You're not looking at one part of the whole.
Right.
The question is not whether the one part treatment is effective or no. The question is it is holistic. It's not. And then you have people who talk about achar. So you will have these yoga practitioners, or you will have, I don't know, a physiotherapist who will come in and say, we can treat patients based on some exercise or some breathing practices or some X or some Y or some Z. Is that holistic? Again, no. And then people which are, so you'll have people who do either counseling or hypnotherapy or some XYZ where they try and alter.
But that by itself is not...
Precisely. None of these are holistic. I can't think of a therapy except for Ayurveda that is actually working on all 4 factors.
So when you prescribe, say for diabetes,
right,
your prescription is ahar, vihar, achar and vichar.
And medicines.
Yes.
Absolutely. And
so
then the home remedies, medicines.
You touch on all of these
I have to, of course. Only then will I be actually covering people from all areas. Right? If someone is coming with a non-exercise kind of a diabetes and with a high stress-related diabetes, you can't treat them the same. You know why people call Ayurveda pseudoscientific? Is because the scientific parameters that they've made are so skewed. Because in Ayurveda, and remember this line very clearly, in Ayurveda, we do not treat diseases. We treat individuals, not diseases. Which means that if you come to me, I am treating you. I am treating Mandira. Right? But if another person who comes with diabetes, then the treatment vastly changes because it's customized. And you know how we're supposed to prove things in scientific way? You're supposed to take 30 diabetic people, give them the same drug, and then try to find out how effective it is.
Clinical trials.
See, exactly. So you skew the trial itself, you structure it in a way where Ayurveda doesn't fit, and then you call Ayurveda unscientific or pseudoscientific. But when you take a single case study, Ayurveda wins hands down. Ask a patient how important it is to them that 30 people get healed with the same drug or that person gets healed with it.
Yeah.
No one's bothered with clinical trials or how many people got better with that drug. What they are interested in, do I get better with that drug? And that is where a single case study comes in. And when you look at a single case study, Ayurveda vis-a-vis allopathy, Ayurveda will always win. But the reason why it's supposed to be pseudoscience, it doesn't work in their skewed parameter.
So, doctor, I started by showing you my wrist. I'm going to end by talking about that. Tell me the technique of diagnosing your patient using entrainment or what you're using.
Nadi pariksha.
So, entrainment is not for diagnosis.
Entrainment is a process that happens. It's a scientific process.
Okay.
That takes place. Obviously you can...
But your way of diagnosis is through the nadi.
It's through Nadi Parikshan. As I said, I don't even have an examination table in my room. My assistant doctor's table will have an examination table. I only solely diagnose with Nadi Pariksha. So when I touch I can give you examples of how things happen. I have a lot of students who come and, learn Nadi Parikshan from me. But Nadi Parikshan is not just like a science, it's also an art. And I've been doing this since I was very young. So I've been seeing patients since I was 14 years old. I was in my 8th standard. I used to come home from school and I had a hero cycle.
Wow.
Used to go to a clinic and start seeing patients there. So I learned Nadi Parikshan under multiple Veds. The minute I figured that, I've learned enough from this Ved, I'll probably shift, to another one. And I've learned that. So it's pretty much like second nature. There are a lot of things that I can't explain how I found out. So I'll give you an example.
Would you say it's a gift?
The minute you say it's a gift, you're trying to tell people that they can't replicate it.
So I can also start reading people.
Absolutely, why not?
Okay.
So,
Doctor, I'm coming to you to firstly for a checkup and everything, but I'm also going to learn how to really, because Ayurveda and holistic healing really fascinates me. And the things we've talked about today have not just been about Ayurveda and not just about actual healing and herbs and medicines, but it was a very deeply spiritual, very nice talk. And I really, really enjoyed this discussion.
Ayurveda and quantum physics are both spiritual.
I feel that the time we had on this podcast was not enough, but I really enjoyed this conversation. It was absolutely fascinating. It was spiritual. It talked about actual frequencies and vibrations and the universe and God and believing and seeking. And from now on, I'm a seeker and I shall always remain one. Thank you.
Thank you. Thank you so much for having me.
Thank you, Dr.
Thank you.
From molecules to mantras, from vibes to vitality, Dr. Manaan Gandhi, you've truly shown us how science and soul can dance together. I'm Mandira Bedi, and this is Nutrify Today Boardroom Series Lite, where we tune in to the right frequency for the future of health. See you at our next exciting show with another equally inspiring guest.